This is Pat Salter with Health Innovation Media, broadcasting live from Health 2.0 in Santa Clara, the 7th annual Health 2.0, a little bit hard to believe. And it's really exciting for me to have with me today Akhila Satish, who is, even though you look very, very young, is the CEO of MyCyberDoctor. So, cool name.
Thank you.
What is it?
So MyCyberDoctor is a healthcare communications company, and we're here actually at Health 2.0 to launch our patient partner application, which is our new adherence app that will be available on the iTunes App Store for iPhone and iPod Touch.
Okay, so it's a patient adherence platform. It's a consumer-facing platform.
It is a consumer-facing platform.
And what's it going to do?
Well, it's
what are you going to get me to adhere to?
Everything, actually.
Oh, good. You can make me lose weight.
Well, weight is actually really hard because Weight Watchers and so on, they're really large groups, so we don't want to even try that necessarily. But in our clinical trial, people did adhere to a physician-prescribed diet for more than 2 additional days a week. So that's 2 days of skipping dessert without feeling it. So that's
great.
That's really exciting, right?
And did it result in any weight loss?
It resulted in not weight, but an HbA1c marker decrease. And so it was a diabetic population that we tested this product in. It was a 12-minute gameplay, and at the end of 3 months, they had a marked improvement in a quantitative biological marker called the HbA1c, which is their blood sugar measure.
So so you've gamified your platform. What do I do when I come over and play?
So I think gamified and game are hard words to sort of put on the platform because it really does break apart some barriers that we haven't seen being broken in this app adherence world yet. We don't have reminders, we don't require a connection to an EMR, and we don't require anyone to have kind of had prior medical knowledge of what they're taking or any of that. It is a pure consumer product that teaches you how you make choices and helps you make everyday healthy choices a little bit better.
So give me an example.
So as you go into the application, which is available for free, you get the opportunity to choose a character and play through a game. The game is really that character faces different events during the course of a day, a couple days, and you really see both the results of non-adherence, but you also see just how hard it is to be adherent. It's very difficult. We all have busy lives. I know I'm not always adherent. No one really is. It's very difficult to balance a family and career and everything else and your health. And the health, sadly enough, is what gets left behind for a lot of people. So we show them that there are other people who also struggle and juggle, and through the story gameplay, really provide them with some unique metrics on how patients think, and specifically how they think. So they get feedback on 3 different metrics. The first is health education, which helps patients understand how am I reaching out, gathering information, and then understanding and applying that information.
So you're not necessarily educating me, you're helping me to understand how I can educate myself?
Yes.
Oh, okay. Well, that's a nice concept.
Yes. So we don't actually provide any educational material. It's all about how patients think and getting them to understand that. So health education is one example. There's a measure called health strategy, which is really fun because that helps us think about whether we think about our healthcare a year down the road or 2 years down the road, or whether we just think about our healthcare, tomorrow. Like, am I going to feel okay tomorrow versus a year? And so helping patients think about that. We also have an emergency response measure, which helps patients to look at how they perform in time of a crisis.
And so one of the things that I think is really interesting that you've done is that you didn't just go in the back room and design this cool app that you love, right? And I'm sure your friends and family love.
I think everyone's going to love it.
Well, that's what an entrepreneur would say. But that's one strategy. And another strategy is to really be brave enough to say, I'm going to subject this to a clinical trial.
Absolutely.
And so who was your partner in the clinical trial? What organization?
It was independently run, so technically it was not a partnership. It was completely independently run, IRB approved through Pinnacle Health Systems in Pennsylvania. So they actually did a wonderful trial for us where it was randomized.
Oh, you weren't influencing it then. It was
completely
passed it over to them and they did the research.
Yeah, they did the entire trial.
Kudos.
Yes, thank you. It was extremely nerve-wracking, actually.
I know. So I said you have to be brave to do that, because what if you do a clinical trial and the answer is this thing doesn't work?
I'm out of a job. But quite frankly, we had to take the decision, and ethically, I didn't want to release something, because you're right, every entrepreneur says everyone loves their app, but loving an app and that app being good for you are very different things. you can have the highest user engagement ratings and no biological marker of improvement.
Right.
And quite frankly, there's a certain value, but then it becomes the value of arts and entertainment versus the value of a medical product. And that's kind of the distinction that we wanted to draw with our clinical
So
trial.
you view your app as a medical product?
Medically based.
Medically based, but are you, with the new FDA rules that have just been released, are they going to impact you? Do you have to go through FDA approval, or are you going to be able to go under, under the rule?
Actually, we're completely clear because we don't offer any medical advice. We don't offer any kind of sensors or anything like that. And I know sensors are a huge part of what the FDA is trying to crack down on, and very rightly so. When I say a medical product, I really mean that it's geared toward influencing the way people view their healthcare, which is medical.
Okay. So I want to ask you some about your personal journey, but before I do that, you mentioned that your trial showed that it lowered hemoglobin A1C.
Yes.
Can you tell us how much did it lower it by?
Sure. So this was, it's exciting to be able to share this finally. It was a non-adherent population, and the HbA1c.
And what do you mean by that?
So the way it works in diabetes is over 6, I believe, is a diabetic population, and then over another threshold is a out of control diabetic population. Not that the patient's out of control, but their blood sugar levels are out of control. And so we actually picked from that group. So everyone
so
in our
you picked
trial,
the ones that weren't really not doing well.
Yes, we were extremely brave, right? So we picked the really hard people to kind of get to be adherent. The mean in our trial was 10.7 was
Whoa.
the HbA1c to begin, which was extremely non-adherent.
Yeah, these are people really out of control.
They're really out of control, and we had the physicians kind of correlate this and say, you know, it's not something sudden, like it's just, they just don't take good care of themselves and would really
So
struggle.
they've had
They've
10 range for a while.
They've had that for a while. And then we were able to drop it by a 10% drop to 9.7 after 3 months. And this is with a one-time 12-minute gameplay intervention.
Oh,
That was
okay.
it.
So short intervention. Did you have a control group?
Yes.
And they didn't.
It was
drop.
not significant.
Okay, so this was a significant change.
Yes.
Well, congratulations.
Thank
That's
you.
good. So if you could do that with one gameplay
For
in
3 months.
3 months,
The hope is that, you know, at that end of the 3 months, you could have them play it again and run through it, and then maybe they would lower another percentage point. We don't know how kind of longitudinal that
Are
looks.
your friends at Pinnacle willing to do a longer trial?
So they're actually looking at 6-month levels, but that's with just that initial intervention. So quite frankly, if we see something at 6 months, it'll be dramatic.
Oh, so they're saying here was the initial intervention.
And they're just following up on it,
Okay,
yeah.
let's see if there's any lingering
Yeah.
effect to it. Okay. But it'd be very interesting to do a larger trial
Absolutely.
over a longer time with continuous use, because that's the other question, you know, with all these apps. We do know that you can get people to use apps once. Well, first of all, a lot of apps don't get used at all, and some get used once, but the real, I think the real goal is going to be is how you get these to be used over time,
Absolutely.
sustainably. So we're going to wrap up here
Sure.
by me asking you, I always like to ask entrepreneurs, I don't know what you were doing before. You were probably in school, right?
I started the company when I was in school, yes.
Oh, okay. So did you always know you wanted to be an entrepreneur? Did you know you wanted to be in healthcare? What's your journey?
So I didn't actually know I wanted to be an entrepreneur, but I've always had this long-held belief that if you have an idea, you have to see it through, because ideas are kind of, take it for what you will, like a gift. And so if you see something a little differently, then you want to sort of go ahead and share that with the community and with everyone else. And sometimes your ideas are bad, and you know it doesn't really make sense. But in my case, my idea really did fill a lack in the marketplace, and I spent a long time researching and looking and trying to see whether that worked and how it worked. And so that's kind of where I arrived at it. I had an idea, and then I just started researching it and working at it, and eventually it just kind of snowballed into, all of a sudden it was all I was doing, and then I was like, oh, I guess this is my job. I'm an entrepreneur now. But it's
So you were an accidental entrepreneur.
I think a lot of entrepreneurs are. I think it's very hard to wake up one day and put that kind of pressure on yourself and say, I want to start a company and I need to think of an idea and then I need to do it. I think that makes it much harder along the journey, because even on my worst days, I have the idea to fall back on, and I have this vision that I can go back to and relate to, and I think that makes it easier to kind of get through the highs and lows of being an entrepreneur.
Well, fantastic. So I know you're demoing your app here today at Health 2.0, and I really look forward to seeing it, and I wish you the best of luck. This
Well,
is
thank you so much.
very
This was
exciting
wonderful.
venture, a very exciting journey that you're on. Thank
Yes.
you, Akhila.
Thank
And this
you.
is Pat Solver with Health Innovation Media, broadcasting from Health 2.0, just finishing up a fantastic conversation with Akhila Satish at CyberDoctor.